I'm David, and this is Max, and we're part of the Helio INC.
The Lassa fever is an acute, fatal, often viral disease that occurs mostly in Western Africa.
And is also called the LHF. Yes, it is a communicable disease, mostly spread in condemned areas such as airplanes, rural areas, and hospitals without protection. And also it is spread by contamination of feces, urine, and food. And Lassa outbreaks occurs every year, and it peaks between December and June.
Some symptoms for the Lassa fever include things such as stomach pain and vomiting, chest pain, loss of hearing, back pain and muscle pain, headaches, and dry coughs.
And symptoms occur after 1 to 3 weeks after the patient had been presented with the virus. And in severe cases, it may lead to damage in the liver, spleen, and the kidneys.
The vector for the Lassa fever is a rodent called the Mastomus natalensis rat, and this rat transmits the disease to people through direct contact with the droppings such as feces and other like saliva, things from the rat, and it can also be transmitted from human to human by blood, which is why patient isolation is one of the best choices of prevention.
And due to its ability to reproduce quickly, it can be hard to contain, but it's likely to have rat traps or get food out of the house and have great housekeeping.
The disease was discovered in 1969 in the small town in which it was named after in Nigeria. Shortly after that, in 1970, the disease spread to other parts of Western Africa, such as Liberia and the Central African Republic.
As undocumented death in Nigeria was first discovered in 1969, and then it went up to over 200 deaths in 2017, but went below 150 in 2018. And the current rates of the virus is about 0.08% in developing Western African countries. However, it's low of 0.01% in developing countries where they have great healthcare. And the infection rate is about 15 to 20%. However, the fatality rate is very low at 1%. And also, due to back in the day, they weren't able to spread the public knowledge of how the disease caused. But now, due to its infrastructure, people know what's the origin of the virus and know how to prevent it.
So as of right now, there is not currently a vaccine for the Lassa fever, although in 2017, the National Institute of Health awarded Tulane University over $12 million to test a promising drug in order to try to find a vaccine for the virus. But as of right now, the best forms of treatment are things such as monitoring and increasing electrolyte and hydration levels. As I said before, the fever can be transmitted from human to human by blood, so patient isolation is always a good form of treatment. And also, there's an antiviral drug called ribavirin, and this antiviral drug has been shown to be successful when used in the early courses of the fever. But there's also evidence against the drug, so that is why they're still in search of a vaccine for the Lassa fever. And so, our surprising fact is that 80% of patients that are diagnosed with the Lassa fever or get the Lassa fever show no symptoms whatsoever. So as an organization, Helio Incorporations, we've made a spray called the Mastomus spray, which is stemming from the vector of the Lassa fever, which is the Mastomus natalensis rat. So our organization is going to go around Western Africa and other places where the disease is prevalent, and we are going to spray them with this spray that we have made, and it is going to kill the rats at a 100% efficiency. And so that is our plan in order to prevent the Lassa fever from spreading around.